Assalamu alaikum everyone, and I just welcome you all on our day 3 of ECG Made Easy. I'm Dr. Sairah Sadaf, and let's start our session. So yesterday we went through the rhythm, excess, hypertrophy, bundle branch block, and ischemia. And our today's topics are AV blocks and cardiac arrhythmias. Basically, AV blocks are also cardiac arrhythmias. So our today's topic is cardiac arrhythmias. We will start with AV blocks, and let's start. Three main types, like first degree, second degree, and third degree. And then in second degree, we have further type 1 and type 2. Now, this is further classification. This is another way of classification of AV block. Like we have AV blocks where there is PR interval is constant, and we have AV blocks where there is PR interval is variable. So among the constant PR interval, we have first degree AV block, and then we have second degree AV block, that is actually type 2. And among the variable PR interval AV blocks, we have second degree type 1 AV block, and then we have third degree AV block. Now, our story will start here. You will learn the AV blocks in such a way today. Never imagine the way I will teach you. Now, all of you have to use your imagination. Okay, just imagine that the P wave is wife and QRS complex is husband, and while the pacer, the final definitive treatment, is actually the counselor or counseling. Just keep these three important characters in your mind, and after that, you will be able to learn all types of AV blocks. Okay, what happened in normal sinus rhythm? There is always a P wave, and then there is always a QRS complex that follows the P wave. PR interval is always normal. This is a normal sinus rhythm. Or now if we convert these waves into the characters, so see this, the P wave, that is wife, she waits at home for the husband, and the husband comes home on every night, on a certain time every night, like for example, say 8 p.m. Okay. So now this is P wave. P wave is the wife. She sits at home and waits for the husband, and this is the husband. He always comes home at time like around 8 p.m. It's always fixed. He's always, and secondly, that's always regular. The QRS complex, the husband is always regular. He is always on time, a fixed time. Now, let's go to the other slide. That is the first degree AV block. Just look at these waves as the characters of a story. Like P wave, wife. The P wave, wife. This is the QRS complex, the husband. Okay, now the wife is waiting at home. Okay, she's sitting there and waiting at home. The husband, that is a QRS complex, he comes late every night. Before that, when there was a sinus rhythm, he used to come at 8 p.m. But now the husband is coming late every night, but he always comes home, and it is at the same time every night, which means that Before that, he was coming at 8 p.m., but now he has started coming late. Now he's coming at, for example, let's say he's coming at 10 p.m., but it's fixed. He's coming late, but at least he's coming home and he's coming at a fixed time. Now he's not coming at 8 p.m., he's coming at 10 p.m. So now, if we convert these characters into the waves again, see this, that the P wave is present constantly at the same interval, it's fixed. And she's sitting there. Okay, about the curious complex. The peer interval, that was actually the time, the husband coming home. When this rhythm was normal, curious complex was coming here. That was 8 p.m. Okay. Now, as for the first degree AV block, the curious complex will start coming late. That means the peer interval is getting longer. The duration of peer interval is getting longer. And instead of coming at 8 p.m., the curious complex is now coming at 10 p.m., but that is fixed. This peer interval is fixed. You got it? And interesting? Now, the cause of this may be some drugs like digitalis, calcium channel blockers, beta blockers, or maybe some others. But there is no need for pacing. Like, at least he's coming home, so there is no need for counseling. Pacing was a marriage counseling, okay? So, although he's coming late, but at least he's coming home, and so far he's not coming too late. Like, before he was coming 8 p.m. and now he's coming at 10 p.m. So there is no need for pacing. Just be alert and just treat the cause. Okay, now second degree AV block. That is Morbid's type 1. Now what's happening here? Let's convert the waves into characters again. Now see this. Now the P wave is waiting at home and the QRS complex coming home later and later and later every night until one night he doesn't come home at all. Okay, now this is the P wave, the wife, and this is the husband, the QRS complex. Okay, now see this. The husband coming home late and late means that the duration of peer interval is getting longer and longer and longer. And one night and one day, curious complex suddenly just missed at all. And or you can say the husband doesn't come home at all. See this. The peer interval was normal here. Then it increases, further increases, and then it increased too much, the time duration. Like say here the husband was coming home 8, here he was coming home at 12, here he started coming home at 4 a.m. in the morning, and here he just disappeared suddenly, so there is no QRS complex. Now, the Mobitz type 1 or secondary AV block type 1 can occur in high vagal tone or maybe during sleep or disease of any conducting pathway. And secondly, it may be benign or it may be associated with acute MI. It needs temporary pacing before surgery. Okay, now temporary pacing means the marriage counseling. He may need a counseling from his friends or his family maybe to just come home early and not to skip the nights at home. Okay, what's Mobitz type 2? Let's see. In Mobitz type 2, now the story changes. This is our wife. This is our husband, the QRS complex. Now, this is wife. There's no husband here. This is wife. Again, there's no husband here. This is wife, still waiting for the husband. And suddenly he came. He just showed up. Now he's coming home again. and he's coming home, and then he suddenly disappeared again. Okay, let's see what's the story. The wife P waves is waiting at home. Sometimes the husband comes home, sometimes he doesn't. See, now here the curious complex is there. The curious complex is there. The curious complex is there. But suddenly in between, the curious complex disappears. Now husband is coming home, and whenever he comes home, he is always on time, and it's a fixed time. Like if he used to come at home at 12 a.m. or 10 p.m. at night, he will keep coming at 10 p.m. at night. But whenever he wants to disappear, he just suddenly disappears. So it is not, this is usually more serious than type 1. Of course, it is more serious, and this will sometimes require counseling, pacing, like marriage counselor need to be involved. Type 1, there is usually, first there is normal peer interval, then the duration starts increasing. It increases further and further, and one day there is no curious complex, or you can say the husband start coming home late, further late, more late, and one day husband doesn't even show up. And in Mobius type 2, so what's happening here? The husband is coming home. Sometimes he comes home and sometimes he doesn't show up. And whenever he comes home, it's always good at normal PR interval, normal PR interval. And then suddenly it just dropped. Okay. Now there is another type. There's 2-in-1 AV block, and there is 3-in-1 AV block. There's different kinds of AV block in second degree AV block. There's a different types of second degree AV block. In third degree AV blocks, things are getting much more serious and complicated because the wife is no longer interested in husband, and husband was already not interested in coming to home. And now both are, she's no longer waiting at home, and her husband, they are now both on separate schedules and have no relationship, and they are no longer talking. And each one has a regular individual schedule. Now, P wave is coming on her own schedule. The wife, the curious complex, is coming on its own schedule. They are both regular. Now, if you see their intervals, RR interval, it's same. The P to P distance is same. They will be coming on their own. Like they are independent from each other. They are independent of each other. They are not depending on each other. They are not following each other. This frequently requires counseling in the form of temporary or permanent pacing. No atrial impulses pass through every node, so the ventricles generate their own rhythm. Atria contract independently, and ventricles are contracting independently. It may be due to extensive MI degenerative diseases, needs immediate pacing before surgery, and these are different ECGs, different kind of third degree AV blocks. You can see like this can have the third degree AV block can be look like this. It can appear like this. It can appear like this. So that was about the AV blocks, and that was a short story about a husband and wife. So let me know if you just understood it well or not. And then I will move to our arrhythmias like tachy. Actually, these AV blocks are also arrhythmias. These are actually the Brady arrhythmias. Now we will go to the tachyarrhythmias. Let me show you a picture from the internet if you can see. Now I have different pictures from the internet for you. This is 2-in-1 AV block. Someone is asking to kindly repeat the 2-in-1 AV block. These are known as the fixed ones. Okay, first of all, these are known as the fixed blocks. These are different types of the second degree AV block. First of all, okay. Second thing is the changes are fixed. Second thing, okay. Now 2-in-1 means there will be one curious complex and then will be two P waves. Two P waves and one curious complex. Two P waves Can you see? Let me use this pointer. 2 P waves, 1 QRS complex, 2 P wave, and then there is 1 QRS complex. Okay, 2 P wave and 1 QRS complex. This is 2 in 1 AV block. Now 3 in 1. Let me show you a nice picture of 3 in 1. Let me 3 in 1. Okay, this is 3 in 1. Like there is a P wave, P wave, P wave, 3 P waves, and then there is 1 QRS complex. Now these changes are fixed. Now, every time there will be 3 P waves and 1 QRS complex. 3 P wave and 1 QRS complex. Okay, you got it? Someone was asking, SM was asking about arrhythmias. First, we have studied the bradyarrhythmias. Those are the AV blocks. Now we will go through the tachyarrhythmias. There are different kind of tachyarrhythmias. First, I have different kind of classifications for you. There's narrow complex and broad complex, and among those we have regular, irregular. We have regular and irregular broad complex tachyarrhythmias. Okay, now we have different kind of tachyarrhythmias. The tachyarrhythmias, we have two types of the narrow complex, and then there is the broad complex. Narrow complex are those which are actually having QRS complex less than 3 small squares width or 0.12 seconds, less than 2.12 seconds. Okay. And when we call it wide complex tachycardia or tachyarrhythmias, when it is more than 3 small squares, most of the supraventricular, not all, but most of the supraventricular tachycardias are narrow complex. And the other ones like ventricular tachycardias, most of them are wide complex tachycardias. Now among the SVTs, we have regular tachyarrhythmias and we have irregular tachyarrhythmias. Now among regular SVTs, we have sinus tachycardia, we have AVNRT. That is actually that is actually atrioventricular nodal reentrant phenomena. We may have atrial flutter, ectopic atrial tachycardia, junctional rhythms. Now coming to irregular SVTs, supraventricular tachycardias, we have atrial fibrillation, multifocal atrial tachycardia, also known as MAT. We may have atrial flutter, which may have irregular rhythm, and sometimes they are associated with various different kind of blocks. And when atrial flutter is associated with a block, so it will be irregular. But usually when it is not associated with any block, so atrial flutter comes under regular SVTs. Sinus tachycardia. In sinus tachycardia, again the same, just that there will be increase in heart rate, but all other things will be normal. Like rhythm will be regular, QRS complex duration will be normal, P wave will be visible, and it will come before each QRS complex. Peer interval will be normal, just that the heart rate will be more than 100 beats per minute. It's known as sinus tachycardia. Sinus arrhythmia. Now, what happens here? Heart rate increases during inspiration and it decreases during expiration. So everything will be normal. Normal means P. There will be a P, a visible P, a normal rounded P. Peer interval will be normal. QRS complex duration will be normal. Everything is normal. It's just that there will be sometimes there will be increase in heart rate and then there will be a decrease in heart rate. There will be like a normal heart rate and then bradycardia, tachy, brady, tachy, brady. But everything will be normal. What is this? Okay, this is atrial fibrillation. Among all the techie SPTs I'm gonna teach you today, Atrial fibrillation is the only one that will be irregular. All others will be regular SVTs and atrial fibrillation will be irregular. There will be no P wave. These are not P waves. These are aberrant waves. These are not P waves, but there will be a normal duration QRS complex will always be there, but there is no P wave. There will be absent. QRS complex will be there. The duration of QRS complex will be normal, but the distance between every RR wave will be different. So it is known as irregular QRS complexes. Duration will be normal and it will be less than 3 mm or less than 0.12 second. That's why we call it narrow complex tachycardia or narrow complex SVT. Now this is atrial flutter. What we have here, in atrial flutter, there are usually no P waves. And if you say these are the P waves, these are actually not P waves. These are called as F waves, the flutter waves or negative deflected abnormal P waves. These have shape of like a sawtooth, as you can see. Now, these can be present in 2-in-1 ratio, 3-in-1, and 4-in-1, which means that they can be like between two RR waves, there will be like two F waves, or between the two RR waves, there may be three F waves, or between the two RR waves, there may be 4 F waves, or maybe 5. And heart rate, the atrial commonly 250 to 300 beats per minute, which means that these F waves, these will be keep coming more frequently than the QRS complexes. Regularity, it is regular supraventricular tachycardia. It may be irregular sometime. P wave, I have already told you about the P wave, that these are usually not the typical actual P waves. These are the flutter or you can say F waves. About PR interval, because there is no as such the actual P wave, so there will be no PR interval. Or you can say you will not be able to determine the PR interval. And QRS complex, yes, the duration of QRS complex, or you can say the husband, that will be normal. Not only normal, and also it will be like less than 0.12 seconds or 3 small squares. These all are example of SVT, narrow complex tachycardia, where the rhythm is regular. Now about the P wave. Now you cannot see a P wave here, and sometimes P wave is visible and sometimes P wave is not visible, because sometimes P wave just merges in the QRS complex. Sometimes it appears as pseudo S wave over here. Sometimes P wave appears as pseudo R wave over here. And sometimes it just merges with the merges with the QRS complex and you cannot see it. These are the different examples of SVT. Now, now in these cases, there will be a regular rhythm. Rate will be 142 to 220 beats per minute. The duration of QRS complex will be normal or short. You can say less than 0.12 second or less than 3 small squares. P wave often buried in the preceding T wave or QRS complex, or it may present as pseudo S wave or R wave. Okay, so this is our SVT. Nawal is asking SVT and sinus tachycardia. Nawal, in sinus tachycardia, there will be a P wave, and in SVT, there will be no P wave. Yes, Ali Hassan has answered, and it's right. There will be no P wave in SVT. Thank you, Ali Hassan, for answering. Now, these are different shapes, different morphologies, different presentations of SVT in different kind of leads. As you can see, there is no P wave. QRS complex is narrow. You cannot see the PR interval because you cannot see the P wave, of course. This is another type of supraventricular tachyarrhythmia. Sometimes it presents with bradycardia as well. Now, what we have here, there is a narrow complex. QRS complex is narrow, less than 3 small squares or 0.12 seconds. P wave will be inverted, abnormal P wave, rate will be this, rhythm will be regular. If P wave is visible, it is usually inverted, and in lead 2, it is inverted. Okay. And I have some examples of junctional rhythm. Okay, about it. Sometimes the P wave is inverted. Sometimes it comes before the QRS complex. Sometimes it comes after the QRS complex. And sometimes it is hidden in the QRS complex. It is mixed. It just get merged in it. And everything I have told you earlier, these are the same. And you won't be able to determine the PR interval because there will be when there is a P wave is absent or it is merged in the QRS complex, you won't be able to identify the PR interval or you won't be able to determine the PR interval. Now, about this. Now, there are different types of junction rhythms depending upon its rate, and it is as follows. Junctional bradycardia. The rate will be between 40 beats per minute. Junctional escape rhythm. It will be have the same findings, but the rate will be 40 to 60. Accelerated junctional rhythm. There will be the rate will be of 60 to 100, and junctional tachycardia when the rate is above 100. Okay. Now we will go through the ventricular tachycardias now. Premature ventricular complexes. I will just show you the ECGs. This how these abnormalities present on ECG. These are the premature ventricular contractions, also known as PVCs. Rhythm regular, rate normal, PR interval is normal. Unifocal PVCs means only same shape of PVCs. Premature ventricular contractions will start appearing. This is another type. Now, this is multifocal PVCs because the one PVC is going upward and like this, and the other one is going downward. The one is with positive deflection, and the other one is in negative deflection. Multifocal. Bigeminy means there will be two. Now, with every other beat, there is a PVC, like normal, abnormal, normal and abnormal, like this, normal, abnormal, normal, abnormal. This is known as bigeminy. Now, these are the triplets. Now, these are the triplet PVCs. This is the famous ventricular tachycardia. It has a regular rhythm. Rate will be about 180 to 190 beats per minute. QRS duration is prolonged, means that QRS complex will be wider, more than 3 small squares or more than 0.12 seconds. There will be no P wave. The cardiac output will be poor, patient will go into cardiac arrest, and you have to stabilize the patient. These are different morphologies, a different appearances of ventricular tachycardia and different waveforms. Ventricular fibrillation, also known as the cardiac arrest sort kind of ECG. Disorganized electrical signals, irregular rhythm, of course, rate more than 300, disorganized and cannot calculated, duration not recognizable, no P wave, also known as cardiac arrest. This is, of course, asystole. And we have reached our final slide. I want to elaborate it. Let me divide it first. There is a first, now, this classification will go along with P wave. The earlier I have told you a classification of the arrhythmias that was based on the duration of the QRS complex. Now this classification is based on the presence or absence or abnormality of P wave. Okay. Now it's about the P wave. Okay. Is there a P wave? Okay. Yes, there is a P wave. Okay. No, there is no P wave. And yes, there is P wave, but P wave is abnormal. So let me divide it into three parts now. This part, there is P wave. This part, there is no P wave. Okay. And then there is a smaller part where is P wave is there, but it's abnormal. Now about the P wave. Okay, yes, there is a P wave. So if there is a P wave, is P wave always related to QRS complex? Yes or no? If yes, then measure the peer interval. If peer interval is normal, then everything is good. If peer interval is prolonged, it means that it is first degree AV block. Now coming to the no part. Is P wave always related to QRS complex? No, it does not. Sometimes it never. When sometimes it comes under second degree AV block, and when it never correlates with the QRS complex, it comes under third degree AV block. Now that was very interesting actually. Now coming to the no part, when there is no P wave, there is no P wave at all. Okay, so is there a QRS complex? Yes, there is a QRS complex. Okay, or there is no QRS complex. Okay, now coming to the there's no QRS complex. It is asystole or VFib. There is no P wave. There is no QRS complex. It means this is VFib or asystole. Now, when there is no P wave, okay, you have to look for QRS complex. If there is there QRS complex present or not? If it is not present, then it may be VF or it may be asystole. Asystole is really a straight line. Okay, now if there is QRS complex is there, is it narrow complex or it is a wide complex? If it's a narrow complex, you have to look for the regular or irregular rhythm. If it is irregular, it may be atrial fibrillation. And if the narrow complex, QRS complex, is regular, it may be atrial tachycardia or it may be junctional rhythm. Now wide. When QRS complex is wide, we will again go for the regular and irregular. In the regular wide complex tachycardia, it will be ventricular tachycardia. And when there is wide complex tachycardia and it is irregular, it may be ventricular tachycardia or it may be aberrant atrial fibrillation. Okay. Now I will describe this. Now there is a P wave, but P wave is abnormal. Abnormal means either it's inverted or it's mixed up in the QRS complex as pseudo S wave or R wave or so. So it may be what? Or it may be as F form of F waves. If it is in the form of F waves, it is atrial flutter. And if it's inverted, it may be junctional rhythm or it may be atrial tachycardias, multifocal tachycardia or focal atrial tachycardia. So that's all. If you have any questions, you can ask. And I'm clearing this picture so you can take a screenshot of this. And I will show you another picture. You can also take screenshot of that because these are very important classifications of tachyarrhythmias. Give this one. Just take a screenshot of this as well. Okay, Alina is asking how can we differentiate between SVT and VT? Okay, okay, I will tell you. Just wait a bit. I will tell you. SVT and VT, those are very, very different. I will show you. So these were the two important slides. And if there is another one, I had another one too. I thought, okay, this one is also good. If you want to take a screenshot, then take a screenshot of this as well. Okay, now Alina has asked me the difference between SVT and VT. I can answer, but I want someone from my students, the brilliant students, can answer this question. Who will answer this question? Difference between SVT and VT. That was the end of my session. So with that, I think that's the end.